Hello everyone, I'm Pauline Ng, and I'm presenting on behalf of the COVID-19 Critical Care Consortium, a summary report of patients with COVID-19 admitted to intensive care units around the world. By now, COVID-19 has been reported in almost all countries around the world, and a significant proportion of critically ill patients are cared for in the ICU. The COVID-19 Critical Care Consortium, or COVID Critical, was established as a global alliance of healthcare professionals committed to advancing the care of critically ill patients in the pandemic. Since its inception in January 2020, COVID Critical has grown to a presence in 54 countries across 6 continents, with more than 300 collaborating centers and 231 recruiting centers. In this report, we summarize the data from 2,670 patients who were admitted to intensive care units between January and December 2020, including from top to bottom in the graph, 182 patients from Africa, 516 from Asia, 72 from Australia and New Zealand, 710 from Europe, 343 from Latin America, and 847 from North America. The median age was 59 years, and 34% of the study population was female. 49% of the patients had hypertension, and a little more than a third had diabetes. The median time from symptom onset to hospital admission was 7 days, and half of these patients were admitted to the ICU on the same day as hospital admission. During their stay in the ICU, 62% of patients required inotropes or vasopressors, and 19% required renal replacement therapy. In terms of respiratory support, 39% patients were put on high-flow oxygen therapy, and a significant proportion, at 81%, received invasive mechanical ventilation. 13% of patients in our cohort received ECMO. Blood gas parameters show that patients were primarily ventilated for hypoxemic respiratory failure, with a PO2 of 77.2 millimeters mercury, or 10.3 kilopascals, and a PF ratio of 109. As of the end of 2020, 51% of patients in our cohort have been discharged from ICU, and 46% have been discharged from hospital. Among patients who died in hospital, 87% had died within the first 28 days of ICU admission. The COVID-19 Critical Care Consortium has brought together the community caring for critically ill patients with COVID-19. The dataset is unique in its broad representation across countries and centers. Thank you very much.